So it is my great honor at this point to welcome and introduce the mayor of the city of Boston, Marty Walsh. As I think people, he needs no introduction in the city or at this hospital, but I'll introduce him anyway. He started his career as a laborer, rose to lead the Building and Construction Trades Council of the Metropolitan District, and in 1997, at age 29, was elected to the Massachusetts House of Representatives from the 13th Suffolk District. He established himself as a leader on creating and protecting jobs and growing the economy. He also emerged as a champion for civil rights within the legislature and a vocal advocate for things such as marriage equality, which he calls his proudest vote ever as a state lawmaker. He also compiled a strong record in support of communities of color, immigrants, seniors, and all the people of our city and state. And he also became known as the State House leader on substance use disorders and recovery issues. I've had the honor and pleasure of getting to know the mayor since he was elected to his current position. Somebody told me early in my management career that the most successful leaders are those who have the qualities of Buddha. They have both a cool head and a warm heart. And as I've come to know the mayor, he's probably never been compared to Buddha before. But he clearly has the no-nonsense, roll-up-the-sleeve, analytic approach to the management challenges facing the city of Boston, as well as the smarts to deal with them. But he clearly has the cool head, but he also has an extremely warm heart. He is very passionate about the city, very passionate about the people who live in it and work in it, and understands as well as anyone that you can't have a very high quality of life unless you're healthy. And so he is very committed to the healthcare issues facing the people of Boston. So it is a great pleasure for me to welcome the mayor of the city of Boston, Marty Walsh.
Thank you. I want to thank you, Doc. Yeah, I've never been compared to Buddha, and when you talk about calm influence, talk to some of my friends. We'll see if that works too. But it's great to be here today. I want to get a few thank yous. Danny, I want to thank Vicki Kennedy and Dr. Garth Graham as well for their support and all the work that they've done here. There's I think a lot of elected officials have come through here today, and I want to thank them. And I know I see Danny Ryan from Charlestown and Chelsea here. Thank you, Danny. And Danny's been involved in many, many issues for a long time around the recovery world anyway. And I want to thank you for your support. I also think Sal DiDomenico's here, Senator Sal DiDomenico, or he was here. And Representative Aaron Mikowitz, Jay Livingstone, Jeffrey Sanchez, they were all here. I think they were anyway. If they're not, thank you for the thoughts. I want to congratulations also to Joan Quinlan and the Center for Community Health Improvements, Dr. Joseph Betancourt from the Disparity Solution Center, Dr. Wynn from the Boston Public Health Commission. Together, all of these people are leading ways of new research and programming to reduce disparities in our city. Mass General is committed to healing the whole person and achieving lasting recovery and success. And they're doing incredible work tackling substance abuse. And I want to thank Nicole, because for a lot of people out here, Nicole told her story. And it's not easy to put it all out there. It's difficult. And it's incredible when you have somebody that's willing to tell you everything. And what she didn't tell you is the pain and suffering that she went through on her days out there. And she spoke about 9 years of being in recovery. And that 9 years is 9 years of not just simply stopping using drugs and stopping drinking, all of a sudden for the next 9 years you live and you're drug-free. There's a lot of work that has to happen in that time frame. Because when she talked about being banned out of the hospital, it takes a lot of work to do that. And then it takes a lot of work to recover from that. And then it takes a lot of work to prove that you're a different person today in the same exact body. And and I know that in Charlestown and a lot of neighborhoods there is some great sobriety and great recovery. But in particular, because of MGH, the relationship between this hospital and Chad and Charlestown is absolutely an incredible relationship. And again, I want to thank Nicole publicly because, as I said, many people out there today, and as I watch people tell their story of recovery in events like this, I look at the faces, and I can see in some people's eyes a little bit of nodding, a little bit of looking away, because you can identify, maybe not your story with Nicole's story, but there's somebody in your family that has a situation and you don't know what to do. And if you're here today and you don't know what to do, grab Nicole afterwards, because she'll absolutely help you on give you some suggestions on what you need to do for a family. So thank you, Nicole, for your work. But I do want to thank Mass General again publicly for their work, especially to the Charlestown Substance Abuse Coalition. And I know that was announced that you're going to be working with East Boston Health Center. We need to continue to work to empower communities to help them overcome challenges of health problems. We can only make progress if we work together. And that's something that in the past didn't always happen. But we need to work together. Now is a moment in time where everyone is talking about different issues. So now is the time to get government and institutions and the communities together to talk about dealing with challenges, particularly around addiction. We need to continue to move forward. MGH has been a long-standing leader addressing substance abuse and getting people on the path to care. And again, I want to thank MGH for that. The city thanks you for your commitment to prevention and intervention, and we look forward to working and continue to work with this great institution. And with many of you in this room, as I look around, there are people in this room that are in the recovery community that you're here because you are. Thank you for your work as well. We have to look at many of the social, economic, and environmental factors that affect people's quality of care. That's what's happening here at this hospital. They're not just looking at one person at a time. They're looking at the whole premise of what's going on. The partners understand that communities, to reduce barriers to care, that we need to make sure that the partners need to be at the table so we can continue to reduce the barriers to care. And they also identify, when I say they, Mass General identifies how unhealthy behaviors develop and how to reduce indicators. And that's some of the most important work that's going on, because for many years, when people in recovery, if they get into recovery, they weren't studying of where this came from. And there are people in the buildings behind us, and there are some doctors and people in front of us looking at saying there has to be another way. Treatment is important, getting people into treatment and talking about prevention, but there has to be another way, and Mass General is at the forefront of that work as well. The summer is approaching, and it's that time of year where youth engagement is really important here in the city of Boston. And I am thrilled to say today, in case I think everyone knows this, but Mass General is one of our top employers for the Summer Jobs Program and our largest healthcare employer. These are wonderful opportunities to gain the experience and strengthen our community. So not only are they working to help us with many different issues that we're talking about today, they're also working to employ young people. So Mass General is demonstrating each and every day that health and wellness depends on so many factors. It's not simply just the quality of care when somebody comes into the emergency room. It's also about providing opportunities for young people that will come here and work this summer that you never know somewhere down the hall might be wearing a white coat, either a nurse or a doctor walking through these halls because they had a chance, because they went to a school in Boston and they were a high school student, they came in and they met a mentor of theirs. It depends on opportunities, on education, on compassion that we continue to move forward. So I want to thank MGH for upholding these values. I also know they're going to continue to do this for years to come. And I want to thank all of you for being here today. These issues that we're talking about today are some of the most important issues that I can deal with on a daily basis, whether it was as a state representative or as a mayor or just as a person here in the city of Boston. I want to thank you all for being here today. And again, thank you, Mass General, for the great work you do.